Yes, Jayashree, good morning. Good morning. Yes, Anjum, Nas, good morning. Good morning, beta. Good morning. I hope my audio and visuals are perfectly fine. Yes, I hope the audio and visuals are perfectly fine. So just give me a thumbs up in the chat box, beta, that the audio and visuals are perfectly fine. Just a moment, beta. Yeah, just a moment. Fine. I hope everything is fine as of now. Yes. So let us just start with the anatomy of jejunum and ileum. Yeah. And then I will move on to the parts of the large intestine, right? So yes. Chal. Salesh ready? Yeah. Okay. Okay. Perfect, beta. Perfect. Chal. Now we already know, beta. We are already aware of the fact that the jejunum and ileum, okay, they are parts of small intestine. You already know small intestine consists of three parts. Can anyone tell me the three parts of the small intestine? The three parts of the small intestine? Yeah, you already know we have, yes, this one, that is the duodenum, duodenum, right? Yes, travel expert. Hi, Dhanashri. Good morning, beta. Then we have the jejunum, okay, the jejunum, and this one, it is the ileum. It is the ileum. So yes, we have three parts of the small intestine. Yes, travel expert, very good, beta. It is the duodenum, jejunum, and ileum. So now duodenum already I have discussed, beta. It is a C-shaped loop, right? I have already discussed it is a C-shaped loop. Earlier, I already have a very brief discussion about the duodenum. Today, I will be focusing on the jejunum and the ileum part. Today, I will be focusing on the jejunum and the ileum part, beta. So yes, Dhanashri, it's right. It's right, beta. Perfect, perfect, perfect. So remember, beta, the jejunum. Okay. Now, what I want you people to do is to actually create, okay, a table. To actually create a table, and yeah, we will tabulate the difference between the jejunum and the ileum. Okay, we will tabulate the difference between the jejunum and the ileum on basis of certain characteristics. Okay, the very first one, beta, it is the location. It is the location. So remember, or I can simply say, beta, that jejunum, or I'll just write it over here, beta. So location I'll take up separately. So remember, beta, if we see jejunum, it is 2 by 5th of small intestine, and ileum, it is 3 by 5th of small intestine. Okay, if I'm taking collectively as a part of like 5, 2 by 5 it is like jejunum, and 3 by 5 it is ileum. So remember, beta, the jejunum constitutes the proximal. Proximal का मतलब क्या होता है? It is first, right? Proximal means first. Constitutes the proximal 2 by 5 of small intestine. Okay, it constitutes the proximal 2 by 5 of small intestine, whereas ileum constitutes the distal 3 by 5 of small intestine. Small intestine. Now, coming on to the next parameter, beta. Coming on to the next parameter. Arun, good morning. Arun, good morning, beta. Yes, Arun, good morning. So yes, coming on to the next parameter, that is the length. Length. So remember, beta, the length of the jejunum. the length of the jejunum, it is about 8 feet long. It is about 8 feet long, and ileum beta, it is about 12 feet long. It is about 12 feet long, right? So length, yes. The jejunum, it is 8 feet long, and the ileum, it is 12 feet long. Now coming on to the next point, that is the site. That is the site. So remember beta, if we just focus on the location where the jejunum is present, so remember it tends to lie, it tends to lie more in the umbilical region, more in the umbilical region. It tends to lie more in the umbilical region. Okay. Whereas, yeah, if we talk about ileum beta, it tends to lie more in the hypogastrium, more in the hypogastrium. You are very well aware with the fact beta कि we have 9 regions of the abdomen. Okay, we have 9 regions of the abdomen. बीच वाला क्या होता है umbilicus. Okay, बीच वाला क्या होता है umbilicus. So in the center we have the umbilicus. Yes, so jejunum, it is found in the umbilical region. Most of the part of the jejunum, it is in the umbilical region, and below the umbilicus we have hypogastrium. Below the umbilicus we have hypogastrium. So yes, ileum, it is like tends to lie more in the hypogastrium part. Okay. So I hope these points are clear. बेटा फटाफट से एक थम्स अप दे दो चैट बॉक्स के अंदर कि ये चीजें पता चल गई हैं तुम लोगों को. So I'm just waiting for your thumbs up, everyone. So yes, I'm waiting for your thumbs up, everyone. So just give me a thumbs up in the chat box that these points are clear to each and everyone. चल ठीक है. चल perfect 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 बेटा. Now height हो गया, length हो गया, lumen की अगर बात कर ले, the other parameter that I will take over here, it is the lumen, right? So coming on to the lumen part. Now lumen, तो obviously बात है कि lumen अगर ये पाइप है, अगर ये इंटेस्टाइन है, तो ये बीच वाला पार्ट क्या हो जाता है? दैट इज द ल्यूमन, राइट? दैट इज द ल्यूमन. जयश्री रुकाला, वेरी गुड बेटा, वेरी गुड. ओके, जयश्री रुकाला, वेरी गुड बेटा. यस. So coming on to the lumen beta, lumen, remember that the lumen is wider than ileum. Okay, the lumen of jejunum, it is wider than ileum. Okay, it is wider than ileum, and the ileum, okay, it is like narrower, the lumen is narrower than jejunum. Okay, the lumen is narrower than jejunum, right? So yes, that was about the lumen part. So we have already discussed that proximal 2/5 will form the jejunum, distal 3/5 will form the ileum. The length of the jejunum, it is 8 feet long. The ileum, it is 12 feet long. Side, the jejunum lies more in the umbilical region. Ileum lies in the hypogastrium region. The lumen, okay, it is of jejunum, it is more wider, okay, than ileum, and the ileum, the lumen, it is more narrower than jejunum, right? So I hope these points are very much clear to each and everyone. So yes, now coming on to the walls of the jejunum and ileum, we will continue the same table, beta. We will continue the same table. So yes, I will tabulate the differences also, and I will just come back to this picture again. So now, if we talk about the wall beta, now let us first write, and then I will show you in the picture as well. If we talk about the wall of the jejunum, if we talk about the wall of the jejunum, remember beta, the wall of the jejunum, it is thicker. Okay, the wall of the jejunum, it is thicker, having thick mucosa. Okay, it is having thick mucosa. Okay, and remember that it is due to active absorption. You already know small intestine is the part where all the absorption takes place. So in the small intestine, jejunum is the part where most of the no absorption will take place. So that's why it is having thick mucosa beta, due to active absorption of the food, right? Due to active absorption. And remember beta, it is also having thicker musculosa. Okay, musculosa means the muscles. It is having thick muscles beta. It is having thick muscles. Why? Because due to active peristalsis. Due to active peristalsis. You are already aware that peristalsis का मतलब क्या होता है? Peristalsis का मतलब क्या होता है? Rhythmic contraction and relaxation of the muscles of the alimentary canal. Okay, rhythmic contraction and muscles of the alimentary canal, right? So yes, we have thicker mucosa, thicker muscular layer. Why active peristalsis होती है? So that the food is pushed downwards also, right? Later. Okay. Rhythmic contraction, relaxation, so that the food bolus is pushed downwards. Now, if we come to the wall of the ileum beta, if we come to the wall of the ileum, remember comparatively as compared to jejunum, it is having a thin wall. Okay, it is having a thin wall. It is having a thin wall, having, yeah, it is having thin wall, having thinner mucosa. It is having thin wall, having thinner mucosa and musculosa. Now, when I say musculosa beta, you are already aware I'm talking about the muscle layer, right? So, yes. Now, why they are having thin wall and thin musculosa beta? Because digestion. Okay, remember, because digestion and absorption. Because digestion and absorption are less active beta. They are less active in the ileum. Okay, they are less active in the ileum than jejunum. Then jejunum. So yes, the ileum is having thin wall, thin musculosa, and thin mucosa. Why? Because the absorption, it is less active in the ileum part as compared to jejunum. I hope this point is clear to everyone. Just give me a thumbs up in the chat box, beta, if this point is clear to each and everyone over here. Yeah, just give me a thumbs up in the chat box if the point is like clear to each and everyone. Chali, perfect. Okay. Now, so yes, okay. Now you can see the wall, it is having, yeah, circular folds also. Okay, so I will just talk about these circular folds in the next point. Yes, so we have the permanent circular folds. Okay, permanent circular folds. Actually, these are mucosal folds. Okay, these are mucosal folds, and yeah, these are called as plicae circularis. Jay Shri, very good beta. Very good beta. These are called as plicae circularis. Okay. Or it is also given a name of valve of Kirking. Okay. Valve of Kirking. Right. Rishi, good good day beta. Greetings. Good day. Okay. Perfect. So yes, we have mucosal folds. These are called as plicae circularis or valve of Kirking. Valve of Kirking. Okay. So remember these permanent circular folds. They are large in case of jejunum, and they are more closely set. Okay, they are more closely set. They are very large in shape, and they are like more closer to each other. Whereas when we talk about the ileum, they are having these circular folds beta, but they are very small. Okay, they are smaller and they are sparse. Sparse का मतलब होता है बिखरा हुआ. It is like separated. Okay, yeah. Rauti, good morning, beta. So yes, that is about the permanent circular folds. So you can see these circular folds, beta. ये जो line आप लोगों को दिख रही है, these are all circular folds, and you can see these circular folds are like they are more closely set, they are more joined together. But when we come to know the ileum, so this is the ileum, beta, and this is something which I'm showing jejunum, right? So you already know in jejunum these mucosal folds or the circular folds, they are more closer to each other. And over here if you see, beta, these circular folds are very few in number and they are separated from each other. They are separated from each other. Okay, they are separated from each other. So that is about this particular point. This is also called as the valve of Kerke, right? So yes, so yes. Now if we talk about the next point, that is we have talked about the wall, the permanent circular folds, and remember beta, we have villi also. Villi are present in small intestine. So remember the villi in the jejunum region, it is abundant. It is abundant, okay, large and thick. It is abundant, large and thick. It is abundant, large and thick. Compare to the ileum, beta, it is small. It is small and thin. It is small and thin. Okay. Hmm. Now, yes. Now, beta, if we come to the mesentery, you already know we have this mesentery over here, okay, which is like surrounding this. This is the mesentery, beta. Mesentery. So, yes, if we talk about the mesentery, beta, so, okay, if we talk about the mesentery, okay, the mesentery in the jejunum, beta, it is fatless. Okay, if you can see in the picture also, it is composed of less fat, whereas when we compare it with the mesentery of the ileum, the fat is more, the content of fat is more, so it is fatless, abundant, okay, and it is fat more abundant, okay, it is fat more abundant, fat more abundant. Coming on to the next part, beta. So yes, over here you can see, yeah, over here you can see that some part like they are, yeah, windows are present over here. Okay, windows are present over here, but over here due to deposition of fat there are no windows. Okay, no windows. So remember in the jejunum what you will get, the windows will be present, and over here the windows are absent. Windows are absent. Okay, absent. Windows are absent. So we have already discussed the differences on the basis of length, site, lumen, wall, permanent circular folds, villi, mesentery. Mesentery. Now coming on to more differences, guys. So Anjum Nas, yeah, I hope this is clear, beta. I hope this is clear. So yes, good morning, RS Creation. Just give me a thumbs up in the chat box if this is clear to each and everyone, beta. If this is clear to each and everyone, just give me a thumbs up in the chat box. I'm waiting for your thumbs up, everyone. So yes, चल फटाफट से thumbs up दे दीजिए chat box में. Yeah, चलो. Jitendra, okay, okay, beta. Just try to write down the notes along with me, beta. Right? So yes. Now coming on, yeah, Anjum, very good beta, very good beta. Chal, let us discuss more, yeah, more things about that. Okay, so remember we are going to differentiate jejunum and ileum on the basis of pairs patches, pairs patches. Yes, Kapil, yes, very good beta. Pairs patches. So remember beta, the pairs patches, basically I will be discussing the pairs patches in details in a couple of minutes. As of now, just remember beta, it is aggregation. It is aggregation of lymphoid follicles. I will tell you what these lymphoid follicles are made up of. So as of now, just write it down, and then I will, after some time, I'll come to this particular topic again. Lymphoid follicles in the submucosa. Already we know the outermost layer, it is the mucosa, then the innermost, Okay, it is submucosa. Sub means under the mucosa. Okay, we have aggregation, we have clubbing of the lymphoid follicles, and that is something which is called as Usman. Hello, beta. That is something which is called as the Peyer's patches. And remember, the Peyer's patches are absent in jejunum. The patches are absent in jejunum, whereas when we talk about ileum, they are present. They are present. Now, coming on to the next, very important, it is the arterial supply. It is the arterial supply. Now, I want answers from everyone in the chat box. I want answers from everyone in the chat box, beta. Okay, you already know ki we have the abdominal aorta. Okay, we have the abdominal aorta. I even don't need to tell you abdominal aorta. It is a continuation of thoracic aorta. Thoracic aorta is a continuation of arch of aorta. Okay, you already know this particular picture, right? I have drawn it multiple number of times. Right? I have drawn it multiple number of times. Yes. So this is you already know. Yeah. Below the level of diaphragm, below the level of diaphragm, we have, yeah, we have the abdominal aorta. We have the abdominal aorta, beta. Abdominal aorta now giving off a ventral branch. Abdominal aorta giving off a ventral branch. Ventral matlab आगे की तरफ. In front it is giving a branch. Okay. And yes, you already know. Yes, that is the superior mesenteric artery. That is the superior mesenteric artery. Now these superior mesenteric arteries will give off branches to jejunum, and it will give branches to ileum. So this is called as the jejunal artery. We have multiple arteries, okay, which are supplying to the jejunum. That is called as the jejunal arteries. And we have the ileum arteries, okay, or sorry, ileal arteries. Okay, just the name, it will be like this only, the ileal arteries. Okay, we have the ileal arteries. We have the ileal arteries, beta. So yes, you already know the superior mesenteric artery, it is giving off jejunal arteries and ileal arteries. Yes, everyone is right. Everyone is right. So yes. Now, what is the difference between in the arterial supply over here? So yeah, that is something for your understanding, beta. So no need to like draw it. So I've just recap हो गया एक फटाफट से बढ़िया वाला. चल, remember beta, the arterial supply to the jejunum, okay, the arterial supply to the jejunum, it is via jejunal arteries, and remember, these arteries will combine to form arterial arcades. Okay, they will combine to form the arterial arcades. Okay, and these arterial arcades will give off straight branches that is called as vasa recta. Now I will show you, beta. I will show you. You already know, if suppose, yeah, this is jejunal artery. Okay, this is jejunal artery. This is also jejunal artery. So this jejunal arteries will combine with this. Okay, this jejunal artery will combine with this, and this will form an arc like structure, beta. That is called as this arc like structure. Yes, this is called as arterial arcades, and further it will give straight branches, beta. Further it will give straight branches. Vasa recta. Recta means straight, beta. Okay, straight branches. So that is which will supply to, yeah, yeah, this is one of the jejunal artery, and suppose this is the lumen. So lumen of the jejunum, so it will supply like this. It will supply like this. If you want, you can just see it over here also, beta. If you can see, beta, you can see these arteries over here, right? You can very well see these arteries. These are jejunal arteries, beta. This whole, it is the jejunal arteries. Okay, so these jejunal arteries are forming these arcades. Okay, these are called as arterial arcades, beta. These are called as arterial arcades. And see, beta, these arterial arcades are giving off single branches, straight branches. These are giving off straight branches which are like supplying to the jejunum and the ileum. Okay, which are supplying to the jejunum and the ileum. So yes, which are supplying to the jejunum and the ileum. So remember that these are like straight branches that are being given. Okay, that is something. These straight branches are called vasa recta. So jejunal arteries will form, yes, arterial arcades, and these arterial arcades will have straight branches coming from them, which will supply the, yeah, jejunum, and yes, it is the vasa recta. So remember, uh, the arterial arcades, okay, they are like formed only one to two in a single jejunal artery, and the vasa recta over here, beta, it is longer as compared. Longer means lengthwise, it is very much longer as compared to the ileum wala part. Now coming on to the ileum. Ileum, you already know they are supplied by ileal arteries. They are supplied by ileal arteries. And these ileal arteries are branches of superior mesenteric artery only, right? Superior mesenteric artery gives off jejunal arteries and ileal arteries as branch. Now these ileal arteries will also form arterial arcades, okay? They will also form arterial arcades, and these arterial arcades will land up in vasa recta, the straight vessels. Vasa recta. So remember, beta, what is the difference in the arterial arcades of ileum? They are actually three or six. Okay, it is up to three or six, whereas the vasa recta, it is shorter. It is shorter in length, and it is more in number. It is more numerous. It is more numerous. If you can just see in the picture also, beta, the one which is supplying the jejunum, you can see these are having long vasa recta. These are having long vasa recta, right? These are having long vasa recta. So yes, jejunum वाले में, और if you compare it to the ileum वाला, बेटा नीचे ileum हो गया ना, ये ileum हो गया, तो ileum में देखो, the length of the vasa recta is small. The length of the vasa recta is small. The length of the vasa recta is small. So yes, that is about the arterial supply. That is about the arterial supply. I hope everyone got this. Just give me a thumbs up in the chat box, beta, if it is clear to each and everyone. I hope this is clear to each and everyone. Just give me a thumbs up in the chat box, beta, if it is clear to each and everyone over here. Now, coming on to the venous drainage, beta. Coming on to the venous drainage. Sure. Very good, Anjum. Very good, beta. Very good. Now, coming on to the venous drainage. Now, venous drainage, beta, of jejunum, it is by superior mesenteric vein, and I even don't need to tell you, right? Okay. So you are very well aware, superior mesenteric vein and the splenic vein will combine together to form the portal vein, right? Portal vein will divide into right and left branch. Okay, so that is something very much clear. Sethi Usman, Jai Shri Vishnu, very good, beta. Very good. Prasanna, very good, beta. Very good. So it is the superior mesenteric vein, and over here in the ileum also we have the superior mesenteric vein. Superior mesenteric vein. Now, beta. Yes, very good, Vishnu, very good. Very good. Now coming on to the nerve supply before the lymphatic drainage. Okay. So if we talk about the nerve supply, beta, the nerve supply for both the jejunum and ileum, it remains the same. Okay. For both the jejunum and ileum, it remains the same. Yes, sympathetic nerve supply, it is from, yeah, it is from T9, T10 and T11. T9, T10 and T11, and parasympathetic nerve supply. Okay, parasympathetic nerve supply. Okay, parasympathetic nerve supply for both the jejunum and the ileum. It is posterior vagal trunk. Posterior vagal trunk. You are already aware we have the vagus nerve, and specifically the posterior vagus trunk. It is supplying the jejunum and the ileum. Okay, so nerve supply, venous, arterial supply, all the other differences are done. Now coming on to the last one, that is the lymphatic drainage. The lymphatic drainage. So if we talk about the lymphatic drainage, lymphatic drainage of, yeah, We already know we have the jejunum and the ileum. So in case of jejunum beta, it is the superior mesenteric lymph nodes. It is the superior mesenteric lymph nodes. It is the superior mesenteric lymph nodes. If we compare it with the ileum part beta, it is the okay. Now we have certain lacteals over here. Okay, these are lacteals which are present over here. If you can see, these are lacteals. Okay, so yes, remember beta. Yeah, we have the lymph coming from lacteals. Okay, lymph from lacteals. Now, what are lacteals, beta? Basically, these are intestinal villi only. These are intestinal villi which absorbs fat. Okay, these are intestinal villi which absorbs fat, which absorbs fat. Okay, I'll just correct the spelling of absorbs. Yeah, which absorbs fat. Which absorbs fat, right? So remember, these will form lymphatic plexus beta. Now, when I say lymphatic plexus, I'm talking about the network, okay, the network over here. So, yes, these lymph from the lacteals will drain into lymphatic plexus, okay, lymphatic plexus, yes, okay, in the walls of ileum, in the walls of ileum, in the walls of ileum, then they will drain the lymph into the mesentery, the lymphatic vessels. So you can see this is the mesentery beta. This is the mesentery. In the mesentery, you can see these lymph nodes. You can see the lymph nodes over here. So yes, they will drain the lymph. Okay. So we have the lymphatic vessels in the mesentery. In the mesentery, right? Then it will drain into juxta. Juxta means side, yeah. Juxta intestinal lymph nodes. Intestinal lymph nodes. Okay. It will drain into mesenteric lymph nodes. Mesenteric lymph nodes. Then it will drain into superior central lymph nodes. Superior central lymph nodes, and finally it will drain into superior mesenteric lymph nodes. Superior mesenteric lymph nodes. Superior mesenteric lymph nodes, right? So remember beta, ये जो आपको plexus की formation दिख रही है, so you can very well see over here, yeah, you can very well see. So yes, these are the lymph nodes. Okay, then they will drain into, yeah, we have the mesenteric lymph nodes. You can see in the mesentery the lymph nodes are present. Okay, then we have the superior central lymph nodes. Okay, the superior central lymph nodes, and automatically we have the, yeah, superior mesenteric lymph nodes. Okay, superior mesenteric lymph nodes. Yes. So I hope this is clear to each and everyone. Beta, just give me a thumbs up in the chat box if it is clear to each and everyone. So just give me a thumbs up in the chat box if it is clear. The anatomy of jejunum and ileum I have done in a very concise manner, and I have already discussed the relevant points: the length, site, lumen, wall, circular folds, villi, mesentery, pairs patches, arterial supply, venous drainage, nerve supply, and lymphatics. And lymphatics. Yes, Anjum, very good, beta. Very good, beta. Now coming on to the pairs patches, guys. Coming on to the pairs patches, I want everyone to reply, beta. Chal. Starting with the pairs patches, beta. So remember, beta, they are about 20 to 30 in number. They are about 20 to 30 in number. Okay, they are about 20 to 30 in number. Yes. Now, they are more prominent in children. They are more prominent in children, and they disappear in old age. And they disappear in old age. They disappear in old age. Okay. Now, beta, how the Pear's patches are formed? They are formed by collection of lymphocytes, and plasma cells. They are formed by collection of lymphocytes and plasma cells. They are formed by collection of lymphocytes and plasma cells. Now, remember, beta, they are, or each patch, okay, each patch, it is about 2 to 10 centimeter long. It is about 2 to 10 centimeter long, right? Remember, beta, the villi, okay, they are absent over patches. This is again an important point. The villi are absent over patches. The small intestine, it is containing villi, but over pair patches, it is absent. Okay. And again, a clinical correlation that you have to remember, beta. These pairs patches, they may be affected. They may be affected in typhoid fever. In typhoid fever, producing ulcers. Producing ulcers. Okay, they may be affected in typhoid fever, producing ulcers. Okay, so yes, that is a clinical point that is related to Pear's patches, right? Now, coming on to the next topic, Peter, that is the mesentery of the small intestine. Coming on to the next topic, that is the mesentery of the small intestine. Moreover, you can just see in this picture also how beautifully it is given. So if we just try to label, beta, ये तो duodenum वाला part हो गया, ये तो duodenum हो गया, and this, can you see this part, beta? It is the jejunum. Then we have the ileum part, beta, ileum. You can see the venous drainage, beta, the arteries over here, and they are all contained in the mesentery. Mesentery. So mesentery is a peritoneal fold, beta. So इसी mesentery के अंदर, inside this mesentery, beta, you will see these veins and arteries. So remember, beta, if we talk about mesentery, it is peritoneal fold. It is peritoneal fold enclosing. It is enclosing free part of small intestine. Now, when I say free part of small intestine, you already know I am talking about the jejunum and the ileum. Okay, I'm talking about the jejunum and the ileum. So it is a peritoneal fold which is enclosing free part of the small intestine, that is the jejunum and the ileum. Okay, and remember that this peritoneum connects, okay, it is connecting the jejunum and the ileum to the posterior abdominal wall. Posterior abdominal wall. So you already know we have these jejunum. I'm just drawing like this so that it's way clear. And this is the jejunum, this is the ileum, and we have this posterior abdominal wall. Posterior abdominal wall. So this is the mesentery which is, so yeah, this is the mesentery which is connecting this jejunum and ileum to the posterior abdominal wall. Yes, to the posterior abdominal wall. Yes, Anjum, very good, beta. Yes, it is the jejunum and the ileum. Okay, it is the jejunum and the ileum. So yeah, that was just for understanding, beta. So remember, yes, remember, beta. Yeah, what is the shape of the mesentery? What is the shape of the mesentery? The shape, it is fan shaped. वो पंखा देखा है बिल्कुल, जो जापानीज लोग ऐसे, नो, व्हाट वी से, इट इज लाइक दैट शेप ओनली। तो शेप का नाम पता है तो बताओ। इट इज लाइक, इन माय टर्म्स इट इज फैन शेप्ड। Yes, it is fan shaped. Okay. Yeah. Now it is fan shaped and it is having okay, it is having two borders, beta. It is, we have broad free border. Yes, broad free border, and we have narrow attached border, beta. We have broad free border and we have narrow attached border. Now, when I say the broad free border, basically beta, it is 6 meters. It is 6 meters, and obviously it is long, okay, and it encloses jejunum and ileum. It encloses jejunum and ileum. Now, when I say narrow beta, narrow कहने का मतलब है it is 6 inches. ओके, 6 इंचेस। ऑब्वियसली बात है, मीटर्स की बात करो तो बेटा 6 मीटर्स, 1 मीटर इज इक्वल टू 100 सेंटीमीटर, तो वो 600 सेंटीमीटर हो गया। तो ऑब्वियसली बात है, ये 6 इंचेस की अगर मैं बात करूं, तो 1 इंच इज 2.5 सेंटीमीटर, तो 6 इंच खुद लगा लो कितना होगा, 15 सेंटीमीटर ओनली, राइट? तो इट इज ओनली 6 इंचेस लॉन्ग। Okay, it is 6 inches long, right? And it is 6 inches away from the free border. From free border, it is 6 inches away from the free border. That is the depth part. Now, the mesentery beta. The mesentery, okay, you already know the small intestine basically. Okay, the jejunum basically begins from, you already know the jejunum basically begins from the, yeah, if you just want to see beta, we have a flexure over here, and this is called as the duodenojejunal flexure. Duodenojejunal flexure. So beginning of the jejunum, it is from the duodenojejunal flexure, okay, and it is ending beta at ileocecal junction. It is ending at the ileocecal junction. Okay, it is ending at the ileocecal junction. Similarly, the mesentery, it is starting from the duodenojejunal flexure, okay, to the ileocecal junction. To the ileocecal junction. So remember beta that yeah, remember the mesentery, it is attached to posterior abdominal wall, posterior abdominal wall, okay, extending from yes, duodenojejunal flexure, duodenojejunal flexure, and it is, yes, and it is to the right side of ileocecal junction. Duodenojejunal flexure, it is on the left, or ileocecal junction, it is on the right. So yes, it is extending from the duodenojejunal flexure to ileocecal junction. To ileocecal junction. Very good, Anjum. Ileocecal junction. So yes. Now coming on to the contents, beta. Coming on to the contents. So yes, coming on to the contents. So remember beta, the contents of the mesentery. If we talk about the contents, the very first thing beta you will have over here, it is the superior mesenteric artery. Okay, okay, before superior mesenteric artery, what you will see, mesentery, it is covering two intestinal loops. I mean, the small intestine, and which part of the small intestine it is? It is jejunum and ileum. So jejunum and ileum are inside the mesentery. So they are actually the contents only, jejunum and ileum. Okay. Secondly, we have superior mesenteric artery. Superior mesenteric artery. We have the superior mesenteric vein. Okay, we have lymph nodes which are present inside. I have already shown you the green lymph nodes. Okay, the green colored lymph nodes, they are all present in this mesentery. They are all present in this mesentery. So yes, remember beta, we have extra peritoneal fatty tissue. Okay, we have fatty tissue also. It is extra peritoneal fatty tissue. It is extra peritoneal fatty tissue. So that is about the mesentery of the small intestine, Peyer's patches, and anatomy of jejunum and ileum. Now coming on to the next topic, beta, that is the ileocecal valve. That is the ileocecal valve. You remember, beta, that it is, देखो, you already know we have this duodenum. Okay, we have this duodenum. Okay, ये क्या है? Duodenum है. Now from the duodenum, what starts with? From the duodenum, what starts? We have the jejunum. Okay, we have the jejunum. Now there are many loops. I'm just trying to draw one of the loops. Okay, and jejunum continues as like this. Cecum, sorry, ileum, ileum. Okay, and this ileum will open into a structure that is called as cecum. That is called as cecum. So this ileum will continue in the part of the large intestine, that is the cecum, and obviously you know that there will be a valve between the ileum and the cecal, and that is called as the ileocecal valve. That is called as the ileocecal valve. Okay, so that is called, so you can very well see that this is the, yeah, this is the ileum part, beta, ileum part. And if we talk about the ileocecal valve, beta, so this is the ileocecal valve. Okay, so this is the ileocecal valve. It is opening in the cecum. It is opening in the cecum. Okay, it is opening in the cecum. So yes, now beta, you already know. So let us just try to understand. Okay, let us just try to understand. It is the valve. Okay, remember beta. It is the valve which guards the opening of ileum. It is the valve which guards the opening of ileum into cecum. Into cecum. Now, can anyone tell me in the chat box? Can anyone tell me in the chat box where the cecum is present? In which fossa it is present? Already, I have discussed multiple number of times, beta. Remember the site? It is the right iliac fossa. It is the right iliac fossa where this valve will be present. Yes, and obviously the cecum will be present, right? So remember, if we talk about the surface anatomy, beta, if we talk about the surface anatomy, remember it is at point of junction, at point of junction between right lateral vertical plane and the intertubercular plane plane. So if we just talked about, okay, let me just tell you beta. You already know we have this vertical plane. Okay, so this is actually lying at the level of this vertical plane. Okay, and yeah, this is the vertical plane beta. Okay, and yeah, sorry, vertical plane will be like this. Sorry. Yeah. So this is the vertical plane beta that I will be like just showing you. So yes, this is the vertical plane, vertical from top to down, vertical from top to down, right? Vertical from top to down, and we have the intertubercular plane. We have the intertubercular plane. So at the cross section of these two planes, at the cross section or the meeting point of these two planes, this particular valve is present. This particular valve is present, right? So remember, beta. Remember, beta. This Yeah, this valve, it is actually composed of two lips. Okay, if we talk about the structure of this valve, if we talk about the structure of this valve, so remember it is composed of two lips. Okay, and these two lips are, one, it is the upper lip, and one which is down, it is the lower lip. We have two lips. It is a lip like structure, beta. It is a lip like structure. So remember, we have two lips. We have two lips. We have the upper lip and we have the lower lip. The upper lip, basically, beta, it is horizontal. Okay, it is horizontal. It is more horizontal. Okay, and lies at ileocolic junction. It is lying at ileocolic junction. And remember, the lower lip, it is concave and it is more longer, beta. Okay, it is more longer. So concave and longer, and it is also lying at the ileocecal junction. Okay. Sorry, yeah, it is lying at, and it lies at ileocecal junction. So now what is the function, beta? What is the function? Remember that it regulates the passage of इलियल कंटेंट्स. अब इलियल से जो भी like the food, yeah, the contents are coming from the ileum, yeah, the digested products. Okay, from the ileum it will come into the large intestine, right, the cecum part. So it regulates the passage of the ileal contents, yes, into cecum, and it prevents reflux from cecum to ileum. It prevents reflux from cecum to ileum. Okay. Now, if we talk about the mechanism, beta, if we talk about the mechanism over here, so remember it closes actively by sympathetic stimulation. It closes actively by sympathetic stimulation, sympathetic stimulation, and passively by distension of the cecum. Distension of the cecum. अगर सीकम full हो गया है, if the cecum is full, beta, so automatically it will close. That is the passive. Or actively, if it has to close, it is by sympathetic stimulation. Okay. So yes, I hope this particular point is clear to each and everyone. The ileocecal valve, we have talked about the side, the surface anatomy. Okay, it is lying between the vertical plane. Okay, it is lying between the vertical plane and the intertubercular plane. So yes, we have talked about the structure, function, mechanism, everything. So I hope this is clear. Just give me a thumbs up in the chat box, Peter. So yes, just give me a thumbs up in the chat box so that I'm aware that it is like perfectly clear to each and everyone. So yes, sure. Very good, Peter. Very good. Now coming on to the difference between the small and the large intestine. Already we have discussed about small intestine in detail. We have discussed the duodenum. Okay, we have discussed the mesentery of the small intestine, the jejunum, ileum, anatomy of both of them, pairs, patches, and the valve. So finally coming on to the difference between the small and large intestine. Anjum, very good, Peter. Anjum, very good. Very good, Peter. So yes. Now, beta, remember that if we talk about small intestine, and on the other hand, if we have the large intestine, so remember it is the small intestine, it is narrow. Okay. and more mobile, narrow and more mobile, except duodenum. Okay, duodenum is fixed part, right? Duodenum is fixed part of the small intestine. So as compared to the, okay, the small intestine, the large intestine, it is wider. Okay, it is more wider and more fixed. It is more wider and more fixed. Now, next point, you already know the small intestine will contain certain villi. Okay, so presence of villi in the entire small intestine, in the entire small intestine, okay, in the entire small intestine, okay, except one difference that I have told you, it is not present over pair patches, it is not present over pair patches, okay, okay. So yes, and remember the absence of villi in the postnatal life. We have the absence of villi in postnatal life. Now, when I say postnatal, post का मतलब बाद में, natal मतलब birth. So it is after birth. The villi will be absent. Absence of villi in the postnatal life. So I'll just write it correct. It is the absence of villi in the postnatal life. Absence of villi in the postnatal life. Yes, Anjum, it is right. Yes, yes, yes. Now, remember, beta, if we talk about the pairs patches, you already know the pairs patches are present over here, right? The pair patches, these are lymphoid follicles, and these are numerous in number. These are numerous in number in small intestine, and if you, yeah, numerous in number in ileum, specifically which part of the small intestine? It is the ileum along the anti-mesenteric border. Whereas when we talk about the large intestine, beta, it is like we have solitary follicles, single follicles are there. Solitary follicles are present. Solitary follicles are present and they are dispersed. They are dispersed in different parts of the large intestine. Different parts of large intestine. They are dispersed in the different parts of the large intestine. So yes, coming on to the last point of difference, Peter. The last point of difference that you have to remember, very important. The circular folds. The circular folds. Remember these circular folds, or these are also called as plicae circularis. Plicae circularis, or valve of Kirking, or valve of Kirking. They are present in the entire gut. So they are present in entire gut except proximal 1 inch of the duodenum, except proximal 1 inch of duodenum and terminal 6 inches of ileum. Terminal 6 inches of ileum. So these circular folds, which we have already talked about, they are present in the entire small intestine, except the starting point, like 2.5 centimeter of the duodenum, that is the first inch of the duodenum, and the terminal 6 inches, the last like 15 centimeters of ileum. These circular folds are absent. These circular folds are absent. Whereas if we talk specifically about the large intestine, beta, in the large intestine we have like presence of three cardinal features, and these three features I will be discussing in detail. Presence of three cardinal features, specific features which are limited to large intestine only. We have tinea coli. we have tinea coli. Okay, we have sacculations. Sacculations means bag-like structures ban jate hain. I will be discussing this. We have hostrations, and sacculations are also called as hostrations. And we have appendices, appendices, epiploicae. So appendices, epiploicae, they are numerously present in transverse and sigmoid colon. They are multiple, they are numerous present in transverse and sigmoid colon. Okay, they are numerously present in transverse and sigmoid colon. So that is the, I will be discussing these 3 points: tinea, sacculations, and appendix epiploicae in the large intestine that I will start. So before that, I want everyone to answer if it's like clear to each and everyone the difference between the small and the large intestine, the ileocecal valve, the mesentery of the small intestine, the Beer's patches, and the anatomy of the jejunum and the ileum. So now coming on to the parts of the small intestine. So yes, Shali, let us now start with the parts of the large intestine. Shali. Now, before discussing the parts, beta, remember the beginning of the large intestine. The beginning of the large intestine, it is the ileocecal valve. Ileocecal valve, and you already know the ileocecal valve. It is situated in the right iliac fossa. The ileocecal valve, it is situated in the right iliac fossa. Beginning ileocecal valve in the right iliac fossa. Termination, beta. Termination, you already know it is at anal orifice. It is at the anal orifice. I will just show you beta. It is at the anal orifice. Okay. So you already know we have the beginning of the ileocecal valve. It is over here. So and it automatically ends in the anal orifice. पीछे की तरफ है बेटा ये. So yes, anal orifice. आगे मत समझ लेना. ठीक है. So yes, if we talk about the length beta, if we talk about the length, it is 5 feet, or in simple words, I can say it is 1.5 meters long, 1.5 meters long, or approximately 150 centimeter, approximately 150 centimeter. So yes, that is about the beginning, termination, and length. If we come to the parts of the small, these large intestine beta, the parts of the large intestine, let us draw our own diagram beta. Let us try to draw our own diagram, and then yeah, then I will come on to this particular diagram as well. So you already know, you are already aware beta that yes, we have this cecum. Now this cecum, it is like ending up in appendix like this. Yes. Now this cecum, yeah, this part it is called as, you already are aware of these parts. Yeah, ascending colon, transverse colon. Yes. Then we have the descending colon, the descending colon, right? The descending colon. Then we have the sigmoid colon. Yeah, the rectum and the anal canal, right? The rectum and the anal canal. So yes, starting with the labeling, guys, starting with the labeling. So you should be aware that this is the, yeah, this is the cecum. This is the cecum. Yes, this is the appendix वाला part. Appendix. उसमें भी मार्क करेंगे बेटा, no need to worry. This is transverse. Okay, this is the, okay, before that this is the ascending colon. ऊपर की तरफ जा रहा है ना बेटा, बिगनिंग यहां से, तो ऑब्वियसली दिस इज ascending. Yeah, this is the ascending colon. Now this is the transverse colon. Okay, this is the transverse कट लगाते हैं ना, transverse colon हो गया. Then we have this descending colon. Descending colon. Then we have sigmoid colon. Sigmoid colon. Then we have the rectum, and ultimately the ending, that is the anal orifice. Okay, so yes, before coming to the other parts, beta, you already see that a part over here. Okay, if you can just see over here that the part of the large intestine, it is occupied by liver. So that is called, and it is on which side, beta? It is on the right side. It is on the right side. It is on the right side. Liver right side पे होता है. And part of the large intestine, it is occupied a little bit by the spleen on the left side. It is occupied by the spleen on the left side, right? So we have the right hepatic flexure of colon, because this part, it is like under the liver, and this part over the left side, it is under the spleen. So we have two more parts, beta. We have two more parts that you have to mention over here. Yes, we have two more parts. Yes, you just want me, so yeah, I'll just highlight it. So yes, this part and this part. So you already know that this is the right side according to the normal anatomical position. This is the left side. This is the left side. So you are very well aware that this right side, it is, yeah, covered by the liver. So it is called as the right colic. Colic means colon. Flexure. Flexure मतलब होता है ना, bending वाला part हो गया. Right colic flexure, or it is also called as the hepatic flexure of colon. It is also called as hepatic flexure of colon. Okay, and we have this left colic flexion, left colic flexion, or it is also called as the left splenic flexure of colon. Left splenic flexure of colon, right? Because it is covered by spleen. Now, I hope this is clear to each and everyone. The parts up till now, just give me a thumbs up in the chat box if the parts are clear up till now. Yeah. Now coming on to, yeah, you can see a single line bit over here. That is something, yeah, we have. Okay, before that, remember that we have tinea coli that is present right over here along the entire intestinal part. Yes, this is the tinea coli. Okay, the tinea coli, I will be discussing this, no need to worry. Now you can see beta over here in the normal picture. If you can see beta over here, we have these small pouches coming out. Okay, small pouches coming out throughout, and these small pouches, okay, these are called as appendices epiploicae. So if I just want to draw this, yes, it is, yeah, this is appendices epiploicae, and these, yeah, yeah, if you can see these sacculations, these bag like structures which are formed. So yes, these bag-like structures, these are present all over the intestine. These bag-like structures, these sacculations are there. Okay, these bag-like structures are formed. So this is something which is referred as sacculations. This is something which is referred as sacculations. This is something which is referred as sacculations. I hope this is clear to each and everyone. आई होप दिस इज क्लियर टू ईच एंड एवरीवन. यस अंजुम, वेरी गुड बेटा. बाकी सब रिप्लाई भी कर दिया करो सो दैट आई हैव एन आइडिया दैट यू गाइस आर लिसनिंग. ओके, so yes, sure, very good, very good beta, sure. So these are the parts of the large intestine. Again, if you want me to mark, this is the ileum. Okay, ileum देखो वहां से आ रहा है और बीच में यहाँ पे आके खुलेगा. That is the cecum part. That is the ascending colon. Yeah, we have this transverse colon, descending colon. Okay, we have the sigmoid and the rectum. Okay, anal orifice. You already know hepatic flexure, right colic flexure. Okay, the left colic flexure or splenic flexure of colon. Yes, very good, Peter. Chal, we have discussed the parts of the large intestine: beginning, termination, and length. Beginning, termination, and length. So yes, yes. Now, if we talk about the appendices, epiploic beta, so you just have to write the characteristics. Okay, large intestine, I think already I have discussed with you people. Yes, saculations are done, tinea coli. Okay, perfect. If we talk about the characteristic features of the large intestine, if we talk about the characteristic features of the large intestine, I have already told you we will have appendices, epiploicae, okay? We will have tinea coli, and we will have saculations or hostrations. So remember, if we say appendices, epiploicae beta, these are small peritoneal sacs. These are small peritoneal, okay? These are small peritoneal sacs, okay? Filled with fat. Now these, yeah, these sacs, ये बैग के जैसे होता है. It is just like a bag, बोरा जिसको बोलते हैं हम लोग. और yeah, these are small peritoneal sacs. Basically, they are filled with fat. They are filled with fat. Okay, scattered over large intestine. Scattered over large intestine. They are scattered over the large intestine, except appendix. They are not present over appendix, right? They are not present over cecum. Okay, they are not present over cecum, and they are not present over rectum. They are not present over rectum. Appendix, cecum, and rectum. Appendix, cecum, and rectum. Now, tinea coli, basically, these are the large, or you can say the longitudinal muscles. Okay, the longitudinal muscles or the longitudinal muscle fibers of large intestine. Okay, so yes, these are longitudinal muscle fibers of large intestine, right? Saculations or hostrations, basically you already know. Yeah. Now, how these saculations or hostrations are formed? How these saculations or hostrations are formed? You already know the length of tinea coli. It is shorter than the true length of large intestine, then the true length of the large intestine. Okay, so yes, it is causing puckering of the walls, causing puckering of its wall. तो ऑब्वियसली बात है कि अगर ये वॉल स्ट्रेट है, ठीक है, अगर ये वॉल स्ट्रेट है और इसकी लेंथ मुझे बीच में, नो वी हैव द दी सर्कुलर longitudinal muscle, that is tinea coli, and these are the walls. So the length of the tinea coli is actually short than the actual length of the wall. So now what it will do to maintain both the length, it will No. Yeah, the wall will be like pushed inside, okay, and that is something which will, that is called as puckering of the wall of the tinea coli. That is something which will lead to saculations. That will something lead to saculations, okay, that will something lead to saculations. So these are the characteristic features of the large intestine, okay. So we have already discussed this. Coming on to the anatomy of the cecum beta, that is the last part for today, the anatomy of the cecum. So remember beta, okay, we will discuss each and every point that we have discussed in entire. So yeah, I'm just starting with the anatomy of the cecum. I will discuss other parts tomorrow. So yes, the site of the anatomy of the cecum. Remember the site of the anatomy of the cecum. It is yeah, the right iliac fossa. It is the right iliac fossa. Okay, right iliac fossa. Okay. Now coming on to the next part, that is the surface anatomy. Surface anatomy. So remember, beta, surface anatomy. Remember, it is, yeah, it is a triangular area, okay, in the right iliac fossa. It is a triangular area in right iliac fossa. तो अगर ध्यान से देखा जाए बेटा, अगर ध्यान से देखा जाए, so what you will get above, ऊपर की तरफ क्या होगा, it is the intertuber. देखो ये हमारा सीकम है, okay, this is the cecum, this is the cecum. सीकम के ऊपर क्या प्रेजेंट है बेटा, इट इज द इंटरट्यूबरकुलर प्लेन, ओके. सो अबव वी हैव, यस, we have the intertubercular plane. We have the intertubercular plane. Okay, we have the intertubercular plane. Below, okay, below we have inguinal ligament. Inguinal ligament, and you already know the inguinal ligament. It starts from the anterior superior iliac spine to the pubic, yeah, tubercle, that is the pubic symphysis wala part. So yes, we have the interinguinal ligament, and specifically if we talk about, it is the lateral half of the inguinal ligament, okay. And okay, now coming on to the medial side, or medially, what you will get beta, medially we have the, yes, medially we have the vertical plane. You can see the vertical plane beta ऊपर से नीचे तक आ रहा है, so it is medially. Body का midline ये है, so it is towards the midline. Cecum ये है, तो cecum के medial में क्या present है, it is the remember vertical plane, and it is right lateral vertical plane, right lateral vertical plane. Now coming on to the shape and size. Yes, coming on to the shape and size. So remember, it is a blind pouch. It is a, yeah, blind pouch. It is a blind pouch that is approximately 3 inches long. It is a blind pouch that is 3 inches long. Okay. So yes, remember, it is, yeah, it is opening above, okay, the cecum, but it is closing below, right? So remember now, yeah, if we talk about the peritoneal covering beta, if we talk about the peritoneal covering, the peritoneal covering. So remember that it is covered with peritoneum. Okay, it is usually covered with a peritoneum. So remember, it is covered with peritoneum. So it is usually covered with peritoneum. Now coming on to the relations, coming on to the relations. Yeah, coming on to the relations. So you are already aware that we have anterior relations and posterior relations. Relations of the cecum. Anterior relations. Cecum के आगे क्या present होता है बेटा? Anterior relations. You should remember we have the anterior abdominal wall. Okay, anterior abdominal wall, and yes, posterior relations we have also in the anterior part, that is the lower part of the greater omentum. Okay, we can see some coils of small intestine as well. So as of now, just remember we have the anterior abdominal wall. Apart from that, if we talk about the posterior relations beta, if we talk about the posterior relations, remember we have the right psoas major muscle. Okay, we have the right iliacus muscle. These already I have discussed in the posterior abdominal wall, right? Right iliacus muscle. We have right lateral cutaneous nerve of thigh. Right lateral cutaneous nerve of thigh. We have right femoral nerve, like which is behind it. Okay, we have right. Okay, we have right external iliac vessels. We have right external iliac vessels. Now, when I say external iliac vessels, beta, it is the external iliac artery and the external iliac vein. And remember, beta, we have the right gonadal vessels. Now, when I say gonadal vessels in males, it is testicular artery and vein, testicular artery and vein, and we have ovarian artery and vein in females. Ovarian artery and veins in female. So that is about the today's lecture, beta. That is about the today's lecture. Yes, that is about the today's lecture. So yeah, I've discussed the relations of the cecum, the entire anatomy of the cecum, characteristics of large intestine. So I will be discussing the rest part which is left. Cecum हो गया, हम लोग अब ascending colon, transverse colon, descending colon, sigmoid, rectum, appendix, ये सारे parts अब discuss करेंगे one by one. Okay. So yes, I hope it's clear to each and everyone. So yeah, parts of the large intestine, the difference between the large and the small intestine, the ileocecal valve anatomy, the mesentery of the small intestine, the Pear's patches, and the anatomy of the jejunum and ileum in detail, beta. So yes, let's meet up tomorrow at the same time, 10 a.m. in the morning. I will continue with anatomy, and in the evening, I will be taking up biochemistry. In the evening, I will be taking up biochemistry. So yes, yeah. So let us just discuss it tomorrow as. Bye, beta. Okay.